Today in series of Docplexus KOL interviews, we have with us Dr. Akshay Mehta, who's practicing in Nanavati Bridge Candy and Holy Family Hospital in Mumbai. His area of expertise is general cardiology and has authored various books and chapters in cardiology. He has his own website portal called as cardiositeindia.com. Thank you so much, Doctor, for this interview.
Thank you.
So my first question to you is, what are the most important things that one should know who's undergoing a stress ECG?
Well, a few things that has to be known before a stress test is being done is that the doctor doing a stress test should know which kind of patients a stress test should not be done on. That means which are the patients in whom it is dangerous to do. So that is the first thing a doctor doing a test should know. The second thing the doctor should know is when to stop doing the exercise when the patient is on the treadmill. There are certain markers which would tell the doctor that the exercise should not go beyond this limit. Otherwise, it is detrimental to the patient. They may get a heart attack or may collapse. So these two things should be very well known by a doctor doing the stress test and to make it safe. And the third thing, of course, to have emergency equipments in the lab where the stress test is being done. And for the patient who's going to do a stress test, he should report his symptoms completely and thoroughly to the doctor so that a judgment can be made as to whether a stress test can be done immediately or later on. So these are the precautions that has to be done, that have to be taken before a stress test can be done.
So doctor, moving on to my next question.
Yeah.
Which patients would you advise for stress ECG?
The commonest condition where a stress test is advised is a person who has come with chest pain and who has an intermediate likelihood of having heart disease. For example, he has chest pain, he has some risk factors like hypertension and diabetes, and we want to know whether the chest pain is due to heart disease or not. A cardiogram is normal, so there is no other way to know whether the patient has coronary heart disease or not, and hence this is one of the ways in which one can bring out the latent disease, make it more obvious by stressing the heart. Basically, it is stressing the heart so that the heart requires more oxygen, and if it doesn't get enough, it is reflected in the cardiogram which we see on the stress test. So person with chest pain is the commonest. Then of course there are people who we already know who have coronary blockages, but we want to know the extent of those blockages. We want to know whether such a person should undergo angiography and bypass surgery or angioplasty or not. So in other words, we want to quantify the prognosis or the severity of the disease. We already know that there is disease, but we want to quantify the severity, and for that we many times do a stress test. Then of course patients who want to join an exercise program, want to run a marathon for example, or a patient who has to undergo a major surgery and we don't know his cardiac status, sometimes we do stress tests for that. Then of course after a heart attack, to let the patient join a rehab program, we have to do a stress test. So these are various conditions for which stress test is done.
Okay.
Yeah.
So doctor, my next question to you is, should stress ECG be done for healthy individuals to screen them for heart diseases?
See, at the present moment, we don't advise, and the various international bodies which write guidelines, they mentioned that routine cardiac stress test should not be done in a healthy individual without symptoms. The problem is with the stress tests, there are lots of false positive reports and false negative reports. To make myself more clear, a false positive report means an abnormal report in a healthy individual. So supposing tomorrow I do your stress test and tell you it is abnormal, though your heart is completely normal, which happens many times with stress tests, you put unnecessary anxiety on the mind of the person, and the person goes and runs about and does more investigations which are not necessary. On the reverse, sometimes supposing you have heart disease and your stress test comes out to be normal, that can happen, which is a false negative report. So then what happens is that you go away with a false sense of assurance. And then supposing you are a smoker, you have hypertension, you don't care, you eat anything because you feel your stress test is normal. So these are the two drawbacks of doing stress tests in healthy individuals. And that is why it is not advisable to do stress tests. But there are some exceptions. For example, if you are a diabetic and you want to join an exercise program, there is some reasonableness in doing an exercise test. Then there is another condition where you are in an occupation which is in control of other people's lives, like you are a pilot or you are an air traffic controller. Then even if you are apparently healthy, one would do a stress test, keeping in mind the false positive rates and the false negative possibilities, but still some tests can be done. So such conditions, then of course you have multiple risk factors like hypertension, diabetes, and you want to join an exercise program, say you are above the age of 45, 50. Such people also stress test may be a reasonable idea to do. So barring these caveats, a stress test in healthy individual is not advisable. Okay.
So lastly, I would like to ask you, what are the investigations to diagnose people to prevent sudden death and heart attack?
Right. So this is an extremely important question because nowadays we are seeing people apparently healthy suddenly dying, doctors suddenly dying, people who are apparently all right yesterday, today they got a heart attack, chest pain, they have to get admitted. People at the age of 30, 35 are getting heart attacks. So this is a very, very important question, and both two things are important: how to prevent these things, and that prevention is most importantly by lifestyle changes. We are seeing people sitting the whole day, eating at odd hours, not sleeping, not exercising, eating junk food. This is the commonest problem, especially in youngsters. And the second thing is to diagnose whether they have or not. Now for that, what we require is to check their blood pressure, to check their waistlines, to check their blood sugars, to check their cholesterol. These 3-4 things must be measured in everybody above the age of 20. Then of course, based on these reports, further things may be required. Based on your cholesterol report, supposing it is very high, sometimes we do what is known as a CT scan of the chest to know whether your calcium deposits are there in the coronary arteries or not, which is called coronary artery calcium scoring. If the score is 0, it is very good. Usually people with a score of 0 are usually immune from sudden death or heart attack deaths for at least next 5 to 10 years if they have a good lifestyle. So that is one. Second thing is to do certain blood tests like HSCRP and ApoB, and sometimes we measure the blood pressure in the upper limb and the lower limb. If there's different, or the difference in the blood pressure in both the arms, that suggests that there is some disease. So these are the people in whom we would advise to go stronger in terms of lifestyle changes, and maybe we sometimes advise them medications to prevent heart attacks like aspirin or statin group of drugs, especially if the cholesterol is high and if they are at high risk by all these criteria that we enumerated. So if a lifestyle is kept in shape, a person eats lots of fruits and vegetables, reduces junk food intake, walks and exercises as much as possible, no smoking, and if required, if these drugs are given, then heart attacks and deaths can be prevented to a great extent. Okay. One more thing is that many of the heart attacks and sudden deaths are preceded by a warning sign. That means I get a little chest discomfort today and tomorrow I may get a big heart attack. So if I attend to that warning signal now, it's like a trailer of a movie. Before the main movie comes, there is a trailer which comes. And if you are attentive to that trailer and take action in terms of checkup immediately to a doctor, take the drugs, take medications, You can prevent heart attack, you can prevent sudden death.
But most of the patients are not aware of.
Not aware. So it's our duty to educate. So it's yours and our duty to educate people. Right? Okay.
Okay, thank you so
Right?
much, Doctor,
Okay.
for this interview. It was a pleasure having you here.
Yeah, thank you.
Thank you.
Thank you.